Hello, dear friends. It's Dr. Sarah, and today I want to talk to you about your heart. Now, if you're watching this in real time, it is the end of February, and February is considered Heart Health Month in the medical community. Now, it isn't because that we are trying to help the bottom line of the greeting card companies. Actually, February was federally designated as American Heart Health Month by President Lyndon B. Johnson in 1963. And the fact that Valentine's Day arrives in the middle of the month is just an additional boost to members of the healthcare community on educating people about the importance of their heart health. Now, you would think with the fact that we've been educating people about heart health since 1963, uniting as communities, that we'd have good statistics for keeping our ticker in great shape. And unfortunately, that's not true. According to the American Heart Association, cardiovascular disease, or CVD, accounted for over 931,000 deaths in the United States. And the CDC states that it's still the leading cause of death for many men, women, and most people of different races and ethnic groups in the United States. In fact, if you really want to get dire, it's killing one person every 33 seconds. So we're not doing great. And there are many reasons, I believe, why these statistics for mortality are so high. One of the reasons, I think, is because there are populations that have different signs and symptoms that are underrecognized. Another reason is that heart disease tends to be viewed as gender specific. In other words, most people think that heart disease is related to more of a man's issue than a woman's issue. As a result, women who often have different signs and symptoms related to problems with their hearts often get overlooked when they come in for different problems, right? They'll attribute it to a hormonal issue or a digestive issue or a mood imbalance. And that's through no fault of the doctor necessarily. It's because we don't have this awareness yet that there are different signs and symptoms. We are taught about the risk factors for heart disease, and many attribute them to metabolic health, smoking, family history, blood pressure, maybe blood sugar. If people use recreational drugs, high levels of inflammatory markers. But there's other factors as well that, if you look at from an integrative perspective, are often overlooked, right? So integrative doctor is going to look at things such as thyroid disorder, again, underlying inflammation, but what is the cause, environmental issues, blood sugar, but also insulin and how the body is dealing with that, someone's microbiome, the health of the cardiovascular system, cholesterol, and exactly why it might be high or low and how the liver's handling it, and infections, dental health. All of these things are correlated to the heart health. And again, if we just look at those risk factors and don't look at underlying factors that are attributing to overall health and impacting the heart, then we're going to miss it. And furthermore, I talked about how many people have unrecognized signs and symptoms. Women, because what ends up happening is they tend to have heart blockages in smaller parts of their arteries and blood vessels. They get different signs and symptoms. So they can look as things like as hot flashes or digestive issues, or even different mood imbalances, or maybe they might feel anxious for no reason and nobody's looking at their heart. So that's not to alarm you, but it's just to inform you. And in the latest episode of the Essential Oil Revolution, I go into this in more detail. I actually take previous videos. I did a 3-part series at least on cardiovascular health and holistic health support. And I compile all that into my latest episode, as well as a bunch of different articles and information I have on how essential oils can support cardiovascular health. So if we look at essential oils, they are incredible in that they are multifactorial. So not only are they impacting our mind body, we know that stress is related to heart health, right? And the high cortisol and those stress hormones influencing our heart's health. But they also can act as antioxidants. They can help regulate our blood sugar. They can help our metabolic health. They can help with underlying infections, inflammation, all of these different factors. So I go into that in the podcast. So you're going to want to click the link in the video description and head over to the Essential Oil Revolution and learn about how we can look at heart health more holistically, and also how we can use essential oils and other, integrative lifestyle factors to really support our health and our overall health and our heart health, of course. But also, we are overlooking as a society the number one risk factor of cardiovascular mortality. And it has nothing to do with diet, exercise, but it is a big component of how we feel and how it impacts our mind and body. And you're going to have to go to the podcast to find out what that is and how essential oils can help with that. Okay, so go ahead and click the link in the video description. While you are there, if you could go ahead and subscribe, leave a review, it would be appreciated to get the word out on how to use essential oils to support our heart health, and importantly, how to get this information out there to more doctors and people who need it, and other factors we should be considering to take more holistic care of our heart health.